So this is a standard infusion room here at the office. Basically, we try to make comfort the most important thing and safety as well. So each individual is monitored and they're brought into this room. An IV is established with a tiny IV. We generally use a cold spray to help numb any type of symptom during the start of that IV. And then we give medications to prevent any side effects. The most common side effect would be nausea. And we generally use any number of medications to help out with that comfort level. Only a small percentage of people actually do get nauseated, but we prophylax against that just simply because it enhances the patient experience during the infusion. But each chair is comfortable. It is reclining. We generally provide water if the person would like some. And eye shades if they need it, blankets that are heated. We generally ask patients to bring their own blankets if they have a preference, or weighted blankets for some people. Music is also another integral role of this whole journey. And we do provide music through a Sonos type system, and we can alter the music based on the patient's preferences. But it's even better if the individual chooses an ambient type music that they can provide with any type of noise canceling headset. Each individual is then monitored with blood pressure and pulse ox type testing throughout. We can directly monitor the person either by sitting in the room with them or indirectly with a baby monitor type style setting if the person so chooses. And if there's any issues during the infusion at all, the person would just simply either ring the bell or respond to us when we're checking in on them, which is constantly. So the infusion experience itself is generally relaxing. Most people describe it as one of the most amazing experiences they've ever had. But the problem is it's quite noetic, meaning that nobody can ever really put words to what they experienced, much like describing the taste of chicken. It's just really hard to describe the taste of chicken, and you can't say it's not beef or it's not buffalo, or describing the opposite of apple pie. So most individuals kind of have their own journey, and we try to guide them so that they focus on just one or two things, but we frequently tell them that their mind may go somewhere else, and if they have any type of anxiety or a negative situation arise, that they might want to explore that opportunity to evaluate what's going on. And if they have nothing to learn from that opportunity or that anxiety-provoking experience, then just to kind of shut that door and move to a different thought. If the person does have any type of anxiety during the infusion, there are a number of options to work with the individual. And one is we can sit and talk with the individual and help guide them through it. The other option is that they can have the infusion stopped briefly or slowed down, or we can even give medication to kind of relax them. Medications that are similar to Valium or a similar type of medication. But each person has complete comfort and they are totally controlled. The infusion experience stops within seconds after the infusion is stopped.